morning to all of you. Welcome to this weekly briefing of PAHO on the COVID-19 pandemic in the region of the Americas. I'm Sebastián Oriel from the Communications Department of PAHO. We remind you that we will be having simultaneous interpretation into English and Spanish. You can choose your language through the interpretation button. This session will last about 45 minutes and we will receive questions up until then. We have already received many questions via email, and you can also ask your questions via the Q&A button that you'll find at the bottom bar. And we'll also be giving the floor to some of you to ask your questions directly. But first, we'd like to ask you to write to us through the Q&A so that we can organize these questions. We also ask you to include your name and your communications media when you ask your question. As usual, this session will also be followed through the social networks of PAHO, Facebook, and Twitter. PAHO's director, Dr. Carissa Etienne, will now report to you on the current situation of the pandemic in the region and the impact this is having on persons suffering from non-communicable diseases. With her, Jarvas Barbosa, Assistant Director of PAHO, Ciro Ugarte, Director of the Emergencies in Health, Marcos Espinal, Director of the Non-Communicable Diseases Department, and Sivan Alighieri, Assistant Director of PAHO Emergencies, as well as Incidents Manager for COVID-19. And now I'd like to invite Dr. Etienne to give us her opening
Thank
words.
you,
Dr. Etienne?
Sebastian, and welcome again. And thank you for joining us. As of May 25th, there have been more than 2.4 million cases and more than 143,000 deaths due to COVID-19 reported in the Americas. As global cases topped 5 million this past week, Latin America surpassed Europe and the United States in the daily number of reported coronavirus infections. Numbers we suspect are even higher than we know. Two of the three countries with the highest number of reported cases are now in the Americas. There can be no doubt our region has become the epicenter of the COVID-19 pandemic. In South America, we are particularly concerned that the number of new cases reported last week in Brazil was the highest for a 7-day period since the outbreak began. Both Peru and Chile are also reporting a high incidence, a sign that transmission is still accelerating in these countries. All of the alarms that we've sounded, the solidarity that we've called for, and the guidance that we've issued over the past 3 months, all of this was to prepare us for this time. For most countries in the Americas, now is not the time to relax restrictions or scale back preventive strategies. Now is the time to stay strong, to remain vigilant, and to aggressively implement proven public health measures. We have learned from other regions. We have learned what works and what doesn't, and we must continue to apply this knowledge to our context. Now is a time for action, not for diversion. The lives and well-being of millions across our region depend on it. One of the most concerning aspects of the COVID-19 pandemic is the disproportionate impact of the virus on people suffering from non-communicable diseases or NCDs, namely hypertension, cardiovascular disease, diabetes, cancers, asthma, and other respiratory diseases, in addition to obesity. We have never seen such a deadly relationship between an infectious disease and NCDs. Some of the data are truly alarming. especially for our region where NCDs are pervasive. Studies in China show that more than 28% of cancer patients who contracted COVID-19 died, compared with only 2% of overall patients. There are 1.2 million people living with cancer in Latin America and the Caribbean. A review of more than 16,000 patients with COVID-19 found that persons with diabetes were twice as likely to have severe disease or to die. There are an estimated 62 million people in the Americas living with diabetes. Smoking causes cancers, heart and lung disease, and is directly associated with reduced respiratory capacity. Additionally, smoking has been shown to increase the likelihood of developing severe illness from COVID-19. About 15% of adults in the Americas still smoke and may face this risk. In fact, our region has a high incidence of NCDs, and we are deeply concerned for the health of people living with these conditions. All told, approximately 1 in 4 people in our region are at increased risk of poor outcomes from COVID-19 due to underlying NCDs. The COVID-19 pandemic has also disrupted the routine health services that patients with NCDs count on to manage their illness. Many healthcare workers who typically provide care have been redirected to the COVID-19 response, adversely impacting the timely diagnosis and treatment of NCDs. Furthermore, some countries experienced disruption of supply chains, as well as challenges to the distribution of medicine and health products, all of which impact access. Stay-at-home measures, disruptions in provision of healthcare services, as well as the fear of attending care facilities have resulted in reduced elective clinic visits and lower access to renal dialysis, cancer care, and delays in high-priority treatments for patients with NCDs. This puts patients at a higher risk of complications and death from diseases which we know how to treat. This challenge must be addressed head-on by health systems in our region, or we will be faced with a parallel epidemic of preventable deaths of persons with NCDs. First, it is important to find safe methods of delivering essential clinical care for people with NCDs during the pandemic. For example, many countries are quickly scaling up telemedicine, prioritizing scheduled appointments to avoid crowded waiting rooms, and providing services in novel ways. We also must ensure that supply chains for essential NCD medicines are protected and continue to function efficiently, and that these products are distributed to the people who need them. And finally, we need to help people with NCDs protect themselves from COVID-19 to avoid a situation of greater risk. This means providing them with the resources, the support system, and information that is needed to protect themselves. Let's not get trapped in a false dichotomy. Fighting NCDs now is integral to our response to COVID-19. We need aggressive preventive measures to protect people with diabetes, respiratory and cardiovascular diseases from the new coronavirus. We also must ensure timely access to care for chronic diseases to prevent them from becoming life-threatening. PAHO is working with countries in the region and providing guidance to help plan and implement these measures. As cases continue to rise in our region, our efforts to protect those with underlying conditions must intensify. May I remind you that May 31st is World No Tobacco Day. Observing this day in the midst of the COVID-19 pandemic highlights how smoking increases our risks and vulnerabilities to this pandemic and to many other health threats. This year's focus is on protecting the youth from the harms of tobacco. And if there was ever a good time to quit smoking, that time is now. I have said before that our health systems must be resilient and adaptable in times of crisis. The dual challenge of NCDs and COVID-19 has certainly put our resilience to the test. Prior to COVID-19, 81% of all deaths in the region of the Americas was due to NCDs. And 39% of these deaths were premature. That means occurring before 70 years of age. As together we reconstruct and transform our economy, our social protection systems and health systems, we need to place critical attention to the prevention, early diagnosis, and management of non-communicable diseases. Thank you.
Muchas gracias,
Thank
doctora
you very
Etienne.
much, Dr. Etienne. And let's begin now with the questions we received via email, and then we'll go to the questions from the chat. As we said, you have the button called Q&A, where you can write your questions, and we ask you to identify yourselves with your name and your company or your means you work for. We'll also be giving you the floor to ask your questions directly, and aside from writing to us on the chat, we need you to raise your hand. The first question comes from Matt Rivers from CNN, and a similar question from Herbert Cepeda from Voice of America. And the question is,
what is the projection of cases that PAHO considers could happen in the region of the Americas? What, in the opinion of PAHO, do the next weeks and months looks like for the region? Dr. Etienne?
Thank you for this question. In the region of the Americas, COVID-19 cases continue to rise. Latin America is now, as I said before, considered the epicenter of the infection. On May 25th, yesterday, countries reported the highest number of new cases as compared to the previous day. The US, more than 26,200 cases in one day, a 2% increase. Brazil, 15,800 cases in one day, a 5% increase. Chile, more than 4,900 cases in one day, a 7% increase. Peru, some 4,200 cases, representing a 4% increase. Mexico, 2,760 new cases, a 4% increase. And Canada, 1,000, representing a 1% increase. The countries reporting the highest number of new deaths were the United States, a 3% increase, Brazil, 3% increase, and Mexico, a 3% increase. PAHO uses its own COVID-19 model to project daily and cumulative information to support needs assessment at the country level. We also collaborate with the Institute of Health Metrics and Evaluation in their own modeling for specific countries of Latin America. They currently have modeled for some 15 countries in the region, including US, Canada, and Puerto Rico. Let me sound a note of caution. Models have limitations. They are primarily tools to forecast scenarios in complex situations. They must never be taken literally. Situations can be altered based on the particular response in any one country. Based on the PAHO models by subregion, In North America, no substantial change for US and Canada is expected. However, in Mexico, we project continuing increases of cases. For Central America, we project acceleration in El Salvador and Guatemala, and this is now happening at the highest levels since the start of the pandemic. We are projecting a steep increase in Nicaragua, irrespective of the limitations that we have in accessing data. And Honduras remains at the same level as the previous week. In South America, Brazil, Peru, Chile, Ecuador, Venezuela continue to increase. Bolivia, Paraguay, and Uruguay show a slight decrease. For Brazil, the IHME model reports that daily deaths are growing exponentially, forecasting a peak of about 1,020 daily deaths by June 22nd, 2020, and by August 4th, 2020, a total of 88,300 deaths are projected. For Colombia, the IHME model predicts increasing deaths with uncertainty as to when it will peak, so far projecting some 60 daily deaths by August 4th, 2020. Peru is projected to have a peak of daily deaths that are estimated at about 168 by June 30th. And by August 4th, 2020, a total of more than 13,000 deaths are projected. In the Caribbean, Haiti continues with an accelerated growth. There is no substantial change noted in Dominican Republic and Puerto Rico. Slight increases are projected in Jamaica. Cuba continues to report a decreasing trend, while many of the small island states in the Caribbean are reporting no new cases. Specific projections by the IHME have been done for the following countries: Peru, Panama, Colombia, Chile, Brazil, Bolivia, Cuba, the Dominican Republic, Ecuador, Honduras, Argentina, and Mexico. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. I remind you that on the web page of PAHO, you can find the up-to-date information on the coronavirus, and it's www.paho.com/coronavirus, and you'll find the number of cases in the region. The next question is now from Matias Loewi from ESCAP, who asks, the quarantines or confinement next to the other public health measures like social distancing simply delay the appearance of new cases, flattening the curve so that the contagion is less gradual? Or could they make the survival of the virus actually difficult to survive, at least reducing it regionally or nationally without a need to reach the so-called group immunity? Matias Loewis asks, Dr. Barbosa.
Gracias, Matias,
Thank you, Matias, for that question.
As medidas de distanciamento social são muito importantes exatamente por esse motivo, para aplanar a curva, ou seja, para reduzir a velocidade de transmissão da COVID-19. Isso é muito importante porque já sabemos de muitas experiências e, desafortunadamente, experiências, algumas com muita dramaticidade em alguns países e em algumas cidades, porque quando a transmissão da COVID-19 está ocorrendo de uma maneira sem nenhuma medida para detener a velocidade, os serviços de saúde podem e vão ter sua capacidade sobrepassada, muito provavelmente. Assim que, seguro que as medidas de distanciamento social são muito importantes. E é muito importante também revisar o que está passando com a adoção das medidas. Porque para que tenham sucesso, é importante a adesão da população. Então, há que revisar bem como está a adesão da população, que se pode fazer para que essas medidas possam ser mais efetivas, ou seja, ter mais apoio da população em sua implementação. Ao mesmo tempo, é importante ampliar a capacidade de testar. Testar todos os pacientes sospechosos, por exemplo,
suspicious
testar os
cases,
contatos desses
test
pacientes,
all
poner em isolamento
contacts,
de uma maneira adequada, é uma
isolate them
maneira muito
adequately.
efetiva de
All of
seguir
these are
detenindo
effective
a
ways
transmissão
to
do vírus.
continue
Assim
to
que
curb the
as medidas de
transmission of the
distanciamento
virus. So,
social são
social
importantes,
distancing measures
também
are
é
important,
importante
but
ampliar a
also
capacidade de
it's
testes
important
e
to
também o
use
terceiro
the
pilar, que é a
testing and the
preparação
third pillar, which
buena de
is
los
the
servicios de salud.
preparation of the
Essa
health services.
combinação, essa boa
This
coordenação,
combination, a good
seguro
coordination amongst these,
pode
I'm
propiciar que um
sure
determinado
will
país
help
se tenha a
a
redução
given
que se
country to
necessita,
have the necessary
ao mesmo tempo
reduction
que se amplia a
as
capacidade de
we
testes para seguir
expand the testing
deteniendo a
capacity to
progresión del
continue to
virus.
curb the
Gracias.
projection of the
Gracias,
virus. Thank you.
doctor. Vamos a
Thank you,
pasar a la
doctor.
siguiente pregunta,
And we'll
que
go
es
to the
de
next question, which
Alexander
comes
Wild
from
de Vox.
Alexander Wild from
En inglés
Box.
pregunta, South
And in
America is
English, he
now the
asks,
world's coronavirus hotspot. What do countries need to do so that's no longer the case? Doctor Espinal.
Thank you very much for that very important question. And the answer is tricky because countries are different and they are doing a lot of mitigation actions. However, doesn't mean that they are doing it at the level they should. And Dr. Barbosa just referred to that and mentioned one of his remarks of increasing the testing capacity. Most of the South American countries are not testing yet at the level they should. If we look at the case of Chile, 25,000 tests per 1 million people. But most of the countries are testing below 6,000 and 5,000 tests per 1 million people. So in a country of 11 million people, testing of 2,000 cases per 1 million is not sufficient. In a country of 45 million people, testing 2,000 tests per 1 million people is not sufficient. So something they need to do is to increase the testing capacity. That's the only way we will have a clear picture of the situation, and we can move quickly to prevent dissemination and also to make sure reductions are prevented. And the director just spoke about modelings. Modeling is not the right answer always. Models, they have their own pros and cons. So the key issue is here testing. The other thing they important to do, because South America is a region with high inequalities, it's education to the people, information, because we are in a pandemic with a virus that is very difficult, but it's also a pandemic with a lot of fake news. Educating people about the facts is important. And I think it will take time. It's not something that because we said we are testing, it's just is enough. I think it's important to continue the mitigation actions. I mentioned a couple of them. And PAHO will be ready to continue helping the countries to expand and to implement those measures. Thank you.
Gracias, doctor.
Thank you, doctor.
La siguiente pregunta ahora viene.
The next question now comes from Ana Lucia Ola González from Prensa Libre, Guatemala. And she asks, what are the negative effects proven to have by the ivermectin, especially in the treatment of patients in a critical state with COVID-19? Dr. Alighieri? Thank you for that question. It's a recurrent question as I see the use of ivermectin. Ivermectin is an anti-parasite molecule. It's a known drug in the Americas, used for decades in the diseases like onchocercosis and lymphatic filariasis. It's a medication which is included in the research protocols at this time in several countries of the world, including in the Americas, in the Solidarity Protocol. And the state of the art at this time is something we publish regularly with systematic reviews of the assays and the random trials that are being done, and the clinical trials and supervised trials. And as of today, in all the articles published in the world, we've detected no benefits or negative reactions. So that's the state of the art. But it is a situation that's evolving permanently, and we are following it very closely, following all the publications very closely. Thank you very much. Thank you, Doctor. The next question comes from Nicaragua, and we have three journalists asking. Uriel Velázquez from Despacho 505 in Nicaragua, Carlos Fernando Chamorro from the Confidencial, and Lidia Lopez from La Prensa. And I'm going to ask the three questions together. Uriel says that we've seen that PAHO has placed Nicaragua in the local transmission and community transmission phase for COVID-19, but the government has not recognized it officially. How did you come to this conclusion, and what measures does PAHO recommend being at this phase? Carlos Chamorro from Confidencial states, the PAHO reported on this, and what does PAHO respond to the civil society entities that are asking for an inspection in Nicaragua, for an audit of the ministries, hospitals, and laboratory regarding the pandemic and the numbers? And the third question, which is from Lidia Lopez from La Prensa, who asks, the government presented yesterday a white book addressing matters dealt with by the health system, saying that there are no important aspects such as tests or emergencies in the hospitals mentioned in the book. Dr. Ugarte. Thank you for the question. PAHO bases its epidemiologic analysis and from the information received from the countries. PAHO has asked the health ministry authorities, as we've said in past opportunities, for detailed information of all the variables needed to do an adequate analysis of the pandemic, which up until last week were insufficient, and publicly announced additional information which would allow us to conclude that the transmission in Nicaragua is community transmission. This information, or that decision, was communicated during the weekend to the IHR focal point in Nicaragua. So it's a change, a normal change in the PAHO reporting process, which we published in our webpage. In this phase, in order to save lives and reduce the impact on society, it is indispensable to first give transparent figures, report the situation with full transparency so that the population can take the necessary precautionary measures. It's important then to reduce the community transmission, to protect the health personnel, and to implement measures that may maintain the essential community services. PAHO has international experts ready, not only those that are in our country office in Managua, but other experts, international experts, who are available to carry out an evaluation of the situation of the health services and the epidemiologic situation and all the other steps that should be taken under these circumstances. This offer has not yet been accepted by the government of Nicaragua. However, we are calling on all public and private entities in Nicaragua to implement immediately all the recommendations given by PAHO. We believe that under these circumstances, the analysis could be secondary, might take days, but the protection of the life and health cannot wait. Thank you.
Thank you very much, Doctor. Let us now move on to a question that we have on our chat, and that comes from Mirza from News in Guyana. And the question in English is the following.
flatten the curve. Dr. Aldiguieri?
So thank you for the question from Guyana. This is a point that we have stressed and flagged and highlighted for weeks now, the need to expand the laboratory network and the testing. There are different options on the table for the national authorities in order to expand the testing capacities in a country. The first is to increase the number of tests that you can do in your national reference center. The second option is to expand the public health surveillance network, laboratory network using PCR technique. The third option is to expand to automated machines that can do molecular testing, PCR, in hospitals and clinics. And also point of contact care testing. They are in the Caribbean and other countries in this region. There is an access to the TB and HIV network, which can now use some test kits for COVID-19. And this is a whole package of measures that the country can access and implement. Also, they have access to the PAHO strategic fund for purchasing kits, molecular kits at this moment. It also, the strategy, which is linked to very strict investigations of clusters in the case of Guyana and contract tracing activities, ensuring that all symptomatic patients can access and can have a test. Thank you.
Gracias. Tenemos ahora también
Thank you, Doctor. We now have several questions that are linked to Brazil from Sarah Nuvi, from the Telegraph, Elisa Martins from O Globo, and also Angela Bastos, NSC Communication, and also over the chat, Marietta Casarre from Agencia Brasil, that also has questions. So Sarah from the Telegraph asked the following.
About the Brazilian government's attitude and response to the coronavirus outbreak, and is this representative of the region's broader approach or an outlier? Elisa de O Globo pregunta, ¿cómo ven la situación de la pandemia en Brasil, considerando cómo se...
How do you see the situation of the pandemic in Brazil, considering how the virus has spread, and what should be done differently? And if you have any forecast for Brazil. Angela Bastos asked a question that has to do with the borders and whether other countries should close their borders with Brazil in order to prevent an increase in cases. And Gacirri says that since Brazil is now the epicenter of the pandemic, and considering what is being done so far, what would be the urgent measures in order to flatten the curve? Dr. Espinal, could you please take these questions?
It's about 5 or 6 questions. Let's try to make it short. We are concerned. PAHO is concerned. The director just mentioned the increase in Brazil. And the projections indicate that it will continue growing. Bear in mind that Brazil it has the highest number of actual cases, but it doesn't have the highest rate in South America. The highest rate is Chile and Peru. So Brazil still is a vast country, 200 million people and more. The key issue for Brazil is to increase testing. Still, Brazil is about 3,000 and something testing per million people. So in such a vast country, in heavily populated cities like, Sao Paulo, Rio de Janeiro, I think it is vital to implement the mitigation measures to increase testing, to try to have still social distance And if the country decides to open, then, as we keep saying, do a proper analysis on the pros and cons. But the forecast for Brazil, that not only the modeling of PAHO, but several other modelings suggest that the epidemic continues to increase, and we need to make sure we work along with Brazil on that. Let me just say also that the governors of Brazil are also implementing measures because it's a federal state, it's a federal country, so they have the power to implement measures. And our office in Brasilia has been working with the Brazilian authorities since January on addressing the epidemic and helping with not only training, but also education issues, procurement of PCR testing. Our office helped with the purchase of more than 10 million tests. So we're ready to continue working with Brazil, but it's important to keep in mind that the situation in Brazil is not going to stop for the next week or so. We're still a long way to go. Borders, WHO and PAHO don't recommend borders closure. It's a prerogative of every country, and they decide what the best. Now, we encourage them to work between them and intra the countries also. So remember, there is a solidarity in Latin America and the whole of the region, and countries work together. So, and we encourage them to work with them. But certainly the epidemic in Brazil, it's something that still has some way to go. And PAHO is deeply concerned about the situation. Thank you.
Muy bien, gracias, doctor, por las respuestas a múltiples.
Thank you, doctor, for these answers to many questions. The next one is linked to Mexico. Melina Ochoa from Uno TV and Isabela Gonzalez from Reforma ask the following. Melina Ochoa says that in 6 days, Mexico is about to reactivate activities in the country. The increase in infections and deaths continues on the rise. Is it not very soon to let the country open or reopen again? And Isabela Gonzalez asked, how do you see the fatality rate in Mexico that reaches 10.7% according to figures provided by Johns Hopkins University? And why is this being the situation? Dr. Barbosa, thank you for these questions. Well, the situation in Mexico, as our director just gave us some figures, shows that there's a trend, an increase on the rise in the number of cases. But in Mexico, just like in any other country in the world, if we have to analyze the situation, we have to do it by region, by state, in the situation of Mexico, because many a times we face completely different epidemiological situations. Here in the U.S., there are states that have trends, downward trends, and others have to control the spread. So we have to carefully check what is the situation prevailing in each state. What ought to be considered for a proposal in order to open the country? It should be a gradual opening. First of all, we may have to make sure that the transmission has been controlled, because if we're going through a process that is on the rise in the city or in the state, and you start relaxing social distancing measures, it is possible, it is probable that you will have an even greater increase on the number of cases. Secondly, we have to do this in a well-planned manner, beginning with what is essential for the economy in order to reduce the impact on people, to maintain a capacity, test capacity, in order to test all suspected cases, and to have safe monitoring of what is going on, because if you begin with a new wave of transmission, you can stop that process if it is being monitored. We have to monitor how hospital occupancy, intensive care unit beds, all of that has to be controlled and checked and taken into account for a reopening process. And even for services that will be offered, it is necessary to adopt measures such as physical distancing between people,
los servicios que se
to
abren com
not
pessoas, ou
fill
seja,
the
todo o que
services
se
that are
está
opened
planteando
with
de maneira muito
people.
detalhada. Cada
Everything that is
país
being proposed in a
deve
very
fazer
detailed
essa
fashion.
análise
Each
da
country
maneira
must
muito
perform
cuidadosa
this
para,
analysis in a
quando
very
impede
careful way,
processo de
so
abertura,
that
não
as soon
tener
as they go
incremento
through
de
the
la transmissão.
reopening process,
Sobre a
make
taxa
sure
de
that we don't have
letalidade,
an increase in the
isso
rate of
muito
transmission.
provavelmente está
Regarding
reflejando
fatality
que,
rate,
ao
this is
princípio
probably
da
showing that
transmissão,
at the beginning of
México,
the
como muitos
transmission,
outros países do
Mexico, just
mundo,
like many other
teria
countries in
muita
the world,
dificuldade de acesso
had
aos
many
testes de
difficulties in
PCR,
having
assim
access
que os
to
testes se
PCR tests.
concentravam solamente
So the
nos
tests
casos mais
were only
graves.
concentrated on the most severe
Quando a taxa de
cases.
letalidade é o
When the
número de
fatality rate
defunções
is the
por
number
el
of
número de
deaths
casos
multiplied
detectados,
by the number
se
of
você
cases
está detectando
detected,
só
if
os
you're
casos graves,
detecting
seguro que a
only
taxa de
serious,
letalidade
severe
vai, de
cases,
uma
then
maneira
the fatality
artificial,
rate in an
parecer
artificial
muito
way
maior do que
would
é,
seem
na
to be
verdade.
much
Isso
greater
passou
than
com
what it
outros
really
países,
is.
passou com o
This happened in
Brasil,
other countries. It
passa com o
happened with
Equador, ou
Brazil.
seja,
It
quando
happens
se
with
passou com
Ecuador.
países da Europa,
When it
incluso,
happened with
quando se
countries in Europe
incrementa
and
a
others, when we
capacidade
see an
de
increase
testar, como o
in
México
the
está
test
haciendo, o
capacity, just like
Instituto,
Mexico is
INDRE,
doing,
el
the
Instituto
INDRE,
de
the
Diagnóstico de
Institute
Referência de la
for
Secretaría de
Diagnosis
Salud,
and Reference
está
of
em
the
processo
Ministry
nas
of
últimas
Health in
semanas de
Mexico,
ampliar
that
muito
in
a
the last few
capacidade de
weeks
testes.
has expanded
México
the
já
test
tem agora
capacity.
mais de 100
Mexico now has more than
laboratórios,
100
incluso
laboratories
laboratórios
and
particulares que
even
foram
private
treinados e
laboratories
seguiram
that have
pruebas.
been
Então,
trained
eu creio que
and
isso,
that
de
are
uma
performing
maneira,
tests.
que
So
se
it
vai
seems to
poder
me
nas
that
próximas
this,
semanas, com
in a
uma
way,
maior
that we will
detecção
see in the
de los
coming
casos,
weeks,
a taxa de
will show a
letalidade
greater
vai
detection of
abarrar
cases,
para
and then the
nível que deve
fatality
ser
rate will
o
come
mais
down to
real.
a level that should be
Gracias.
as real as possible. Thank you. Thank you, doctor. The next question is by Valeria Heredia by El Comercio Diary in Ecuador. She says that weeks ago, the government of Ecuador mentioned that PAHO will provide more support to Ecuador in order to deal with the pandemic. What sort of assistance has been provided, and what has this assistance been? Dr. Ugarte, thank you very much for that question. Ecuador has received direct support from PAHO from the very beginning. And obviously, when faced with the situation that we had in Guayaquil, there was a significant increase in that support. The support that has been stepped up in recent weeks is the one that has to do with coordination and monitoring of health services over their capacity to respond to the emergency in real time. And that evaluation is performed by using an instrument developed by PAHO, which is applied in many countries. And in the case of Ecuador, more than 300 health establishments have performed it. More than 200 belong to the public ministry, the Ecuadorian Institute of Social Security, the hospitals in public safety, security, military, and police hospitals. But we've also increased our support with supplies, PPEs for the main hospitals. We've had direct assessment in many health establishments together with the Ministry of Health, and we are working on reinstating or protecting the other essential services for the population in general. So we're talking about mother and child population, people with disabilities, people that have chronic diseases, but we're also supporting and providing support in the general coordination in the purchase of supplies at a global level through the different mechanisms available to WHO. In that regard, currently, we're also implementing plans in order to increase our support to specific health services in the areas where the increase of cases is emerging at a greater level than in previous areas. We're talking about other provinces, including the province of Pichincha, where we find the capital city of Quito, and other areas where they do need specific support, both for health services as well as for the implementation of the measures to reduce the spread of the virus. Thank you. Thank you, doctor. Next question on the chat also has to do with treatment and hydroxychloroquine. Urania Molina from La Prensa in Panama asks, what quantity of treatments are being applied in the region of the Americas, and of these, which have yielded the best results for patients that come to hospital intensive care units? And over the chat, Alina Diestre from AFP asked the following. In spite of the decision made by WHO to suspend tests with hydroxychloroquine, the US and Brazil and two other countries in the world with the largest number of cases in coronavirus have maintained the recommendation, continue to recommend the use of this drug. What does PAHO think about this? And what does PAHO tell these people in the different countries? Dr. Alighieri, can you respond to these questions? Thank you for these questions. I will try to answer both questions, which are somewhat different, but I'll try to do it at once. Beginning with hydroxychloroquine. In the last week, during that last week, major articles and major papers and first-line publications, British Medical Journal, Lancet, JAMA, have published articles highlighting some aspects of clinical concern regarding some side effects and some complications. What I'd like to stress is that PAHO, WHO have published guidelines for clinical management of COVID-19. And the organization has not recommended the use of chloroquine or hydroxychloroquine for first-line treatment. However, following some very initial studies in the pandemic in China, for example, they've included hydroxychloroquine and chloroquine in the solidarity studies. And some countries in the region are participating in those studies. During these last few days and following these publications of these scientific publications, high-level scientific publications, WHO has decided to suspend the research arm on chloroquine and hydroxychloroquine. And the board, the security board of the study, that the board that is made up by a significant number of researchers at a global level, is currently reviewing the data in order to see whether they have to continue with that or not. But once again, let me stress that PAHO, WHO, are not recommending chloroquine and hydroxychloroquine for the treatment in following the guidelines that we have. Thank you. Thank you, doctor. Next question comes from Mariana Soquete, Efecto Cocuyo in Venezuela. And they say that thousands of Venezuelans are returning to the country with cases. And we see a rise on the number of cases because of this reason. But Venezuela has done less than 20,000 PCRs in the entire country, including hospitals, and that they have problems with the provision or the supply of water. How does PAHO assess the situation in Venezuela, and what call to action is made to the authorities in Venezuela? Dr. Ugarte, please. Thank you very much for that question. Since the response to COVID-19 is a multi-sectoral response, and it depends on the capacities of health systems, but also other essential services in the community, and part of this is the availability of water, electricity, electrical power, transportation, etc. The situation of a response to COVID-19 in Venezuela is very difficult. However, the measures that have been adopted by the public sector and the private sector point in the right direction. I believe that the only way of responding to the most serious needs is to prioritize the intervention and to make sure that these health services that are providing services, care services to COVID patients have at their disposal essential services, and therefore the contribution by the organization. And I also understand the contribution and the support of many other institutions present in Venezuela have that same outlook and that same priority. We are seeing that the tests that are being performed not only on people that are symptomatic or that show symptomatology that is compatible with the COVID is not enough. Therefore, the social distancing measures and the reduction in the transmission are essential. And this also has to do with the other issue of people that are returning to Venezuela. These persons have to be considered all across the board with a treatment with respect and humanitarian principles. And that, I believe, is vital, considering the fact that these people are returning from places where they've faced a very difficult situation and they're going back to their homeland. Therefore, the commitment of the organization is to continue working with all entities, including the government and the private sector, as well as other scientific and humanitarian entities in Venezuela, to make sure that the entire population, including those that are returning to Venezuela, will have access on a timely basis to health services. Thank you. Thank you, Doctor. The next question is from Gisela Salomon, the AP agency, and she asks, why is Latin America now the epicenter of the pandemic? Does this have to do with the response by governments? Dr. Barbosa, can you answer this question?
Gracias por la pregunta.
Thank you for the question.
Mira, como podemos observar
As we have been able to see all over the world, the pandemic
deslocando de uma área para outra.
moved from one area to the other one. If we remember, in February, we only had cases in Asia, mainly in China. Later on, we started seeing these cases in Europe and North America. And now we begin the transmission in Latin America. And this has been going on for a few weeks. And this is highly linked to contact, be it by tourism, business, that countries had with other countries where the transmission was stronger. So countries in Latin America went through a preparation period that was very important. And many countries implemented their plans and adopted social distancing measures that delayed the spread of the disease, of the pandemic. But now we have a strong transmission, as has already been stated, in some countries in the region, and it might be necessary to draw the attention of all ministries of health so that in that situation they can assess the effectiveness of the measures that they're adopting. Social distancing measures are harsh measures, are difficult measures. They're difficult for society. So it is important to assess in connection with the situation that prevails in each country and in each state or each province in countries and see what are the most effective measures in order to move the population to enforce social distancing, increase social distancing network, financial payment in order to reduce the situation of poverty faced by many families. This is what we'll try to have so that these measures will be more effective in these times of an increase of the transmission, and at the same time to check how it is possible to increase the capacity of health services in a speedy way, fast, if necessary, so that we don't have ventilators available with a surpassed capacity and overwhelmed in ICUs. We hope that in the coming weeks, as the doctor mentioned in the initial opening statement, that we will have some very hard weeks ahead of us, and PAHO is working with the ministries obtaining the best evidence and the best technical cooperation so that we can respond to that situation. That is quite an important challenge for any health system in any country in the world. Thank you. Thank you, Doctor. And with this, we move on to the next question from Spet Lukstik from Health Policy Watch. The question is,
similar measures to integrate COVID-19 in their health services without leaving behind other health services. what countries should do to ensure access to all healthcare services when they are overwhelmed with cases of COVID-19. Doctora Etienne.
Thank you for this question. What we are seeing now is that many countries in our region face what is a heavy double burden of responding to COVID-19 while trying to deliver essential health services. Just to note that this is an important characteristic of what constitutes a resilient health system. COVID-19 has severely impacted health services in many countries that resulted in the overwhelming of some of our health systems. It is difficult to maintain regular essential health services in the context of an overwhelmed system. We have reports of healthcare workers being withdrawn from the first level of care to provide care in hospitals. I wish at this time to list some of the critical, essential services that in my mind must be delivered during COVID-19. Else, we risk having epidemics within the pandemic or having increased deaths from what are preventable causes. Some of these include maternal care, prenatal care and delivery services, immunization services, mental health services, the continued care and access to treatment for non-communicable diseases, including cancer, the continued care and access to treatment for tuberculosis and HIV/AIDS, the prevention, detection, and treatment of malaria, the prevention and management of outbreaks like dengue. WHO and PAHO have published guidelines for the continuation of care during COVID-19, with due considerations for the safety of the clients and the safety of the healthcare workers. Of course, this requires that health systems have been prepared beforehand. Resilient health systems must have the necessary adaptability and the capacity to cope. Strong, resilient health systems must be based on primary health care with equity, solidarity, and a rights approach as its core principles. Universal access and universal health coverage must be guaranteed, and essential public health functions must be fully developed prior to facing a pandemic. Going forward, we must ensure the removal of all barriers to access care. We must put in place financial mechanisms that increase the investments in the first level of care. We must eliminate payment at the point of service and prevent financial difficulties for individuals and households. We must prioritize prevention and essential public health functions as key elements of comprehensive care, and we must assure quality of care. Very importantly, health systems must ensure that no one is left behind. Thank you so much for this question, and thank you for being with us.
Muchas gracias, doctor Etienne. Ahora sí, entonces.
Thank you very much, Dr. Etienne. And with this, we have come to the end of today's conference. We will send, as customary, the opening statement and the recording of this session. We apologize that we were not able to answer all the questions that you addressed to us, but you can continue to be in contact with us by email, and we will answer your questions as soon as possible. So thank you, everyone, and we will continue in contact.